My name's Martha Turnbull. I'm here as the past president of the Travel Health Insurance Association from Canada. I've been president for the last 2 years. Travel Health Insurance Association is an association of industry members who participate in various roles in the travel insurance industry in Canada. So there's third-party administrators, insurance companies, air ambulance providers, network providers, physicians, etc. I work in the travel insurance industry. I'm the head of the claims and assistance area for RBC Insurance. We're one of Canada's largest underwriters of travel insurance, and we have our own assistance company, Assured Assistance. I'm also responsible for those operations as well.
Can you tell us more about what you're going to talk about today?
My speech today, or my talk today, is from a Canadian perspective, the opportunities and challenges for Canadian travel insurers and where the market's going, and as well from an industry association perspective, what are the challenges that are facing air ambulance providers in the Canadian market and internationally. I think the medical tourism landscape is changing in respect of obviously cost. From a travel insurer's perspective, it gives us the opportunity to understand where quality providers are, where we want to form alliances with those providers. As the Canadian tourist is traveling to farther out regions, to more remote areas, it's really important that we understand where travel tourism is going is one clearly of a global community. We've heard lots of presentations at the conference on the globalization of the world community and people seeking health care where they feel comfortable and there is care quality. This is an interesting opportunity for us to look for opportunities to work together, certainly to approach medical tourism from the point of view of the Canadian who may or may not want to seek treatment outside of Canada, and looking for opportunities to understand how we can work better in the future together. This is the first time I have attended the conference. I've been really impressed with the organization. Lots of moving parts, lots of different speakers, very well organized. The caliber of the speakers has been tremendous in terms of the knowledge of their subject, how things integrate, and how they've been able to address what their audience is really listening or coming to listen to. They understand what their audience wants, and it's been so far a great conference for me.
How did the networking meetings go?
Network meetings have been very interesting. It's a great opportunity to meet different providers who are part of the medical tourism community and understand more about how we could potentially work with them on a contractual basis, how we could be comfortable referring our clients to them who are traveling actually in their location but have a medical emergency. That's what could the medical tourism industry do to get their message across is really perhaps a grassroots operation in terms of people, world communities understanding what those opportunities are. As well, certainly approaching different human resource consulting firms who manage or make recommendation in terms of benefit structures for Canadian employers to perhaps fast forward access to health care for their members or their covered employees so that they can get them back to work faster. So you don't have the cost of absenteeism, and really looking at that opportunity to cost out what absenteeism while Canadians are waiting for care versus being able to get Canadians treated and back to work. You were questioning about the quality of healthcare in Canada and the United States. And like the United States, there are regional differences in terms of the accessibility and availability of care. And so Canada has a very large regional or rural population where there aren't tertiary services, tertiary centers. And there can be, in some areas, longer waits for different types of procedures. Certainly, governments have been given the mandate to improve care turnaround time, so access to care being much faster through better funding mechanisms. Healthcare is moving into the business world as opposed to being strictly a healthcare economics. And as a result, wait times are dropping in Canada. But still, the need to seek treatment elsewhere potentially does exist. Healthcare in Canada perhaps because there isn't the same economic bonus to the physician and the facility to do procedures, they live within global budgets, it does change the economics of healthcare delivery somewhat.